So we are at the Clinical Application of Longevity Medicine 2026 in Fort Lauderdale, and today I have the awesome opportunity to interview Dr. Joe Gretzula, who is not only a pharmacist but also a physician. So talk to us a little bit about your background and what made you have the switch.
Well, as I said, I started off as a pharmacist and was really fascinated with pharmacology and pharmacognosy, which is the study of medicinal plants, fungi, and animals and their potential benefits for our healing. And so as I progressed onward into pharmacy school, I then went to medical school and chose an osteopathic school because I believed in the holistic approach to healthcare. And then from there, here I am, involved with dermatology, and I go, and I'm right there in the middle of the AIDS epidemic. I was involved with immunology, studying Langerhans cells and the skin and the importance in immunology and capturing what was going on with AIDS. And at that time, I published an article where I found multiple cutaneous infections in a single lesion. And from there, I realized that, wow, there's so much going on in the world of dermatology. And I was in a very academic program, and I'll never forget, I was doing a paper on something called epidermolysis bullosa, and I talked to this world's expert from North Carolina, and I said, "Doctor, you know everything about this disease. I'm so amazed." And he goes, "I know nothing." And it was then that it opened this avenue in my mind, and I said, you know what? Now I realize it's not what we do know, it's what we don't know. And I think that's what all of us in this business now are striving for, is to find out what we don't know and how we can address these factors to improve patient care.
Yeah. One of the things that I thought was so enlightening about your lecture is how you connect the inside to what is happening on the skin. So you actually told me, I think maybe it was at lunch yesterday, how that there's now even a subspecialty of, is it integrative dermatology?
Integrative dermatology.
Yeah, so
yes.
Talk to us a little bit about that gut-skin connection. And then my next question is, let's talk a little bit about how we can improve the gut terrain with some of our favorite peptides.
I was always fascinated with the skin microbiome and the gut microbiome, primarily the gut microbiome, because people really were talking about the skin and realizing that they were symbiotic in their relationships. And so I became fascinated with it, and I started looking into it a little bit more. And I can remember 20 years ago, as long as it's 5 billion or 10 billion, I never realized it's far more than that. It's not the quantity, it's the quality of the product that we're using. And so I started tinkering around with different companies and what have you. And then a couple of years ago, I met the people from Pendulum and Christine O'Connor and Colleen Cutliff. And I learned, wow, I started talking about different probiotics and learned about Akkermansia eosinophilus and then some other things. And it just really started to get me more involved in realizing in my practice in dealing with general derm and dealing with people with eczema, atopic dermatitis, acne vulgaris, psoriasis. And I said, there's this relationship. It's inflammatory, and we realized then with studies looking at these things, the importance of the gut microbiome and the skin.
Right. So one of my favorite supplements that we use in our practice is a product called Peptides. We also will use Regenerative. So those are nutraceuticals made by New BioAge, where they pair BPC 157 with Thymosin Beta-4. We use that a ton in our regenerative aesthetics procedures. I know you do as well. So talk to us a little bit about why those two peptides together. What impact are they having on not only the gut health, but how is that going to help with recovery?
Well, it's going to help tremendously with recovery. I mean, everybody knows about BPC 157. It's an anti-inflammatory effects. And particularly when I talk to patients, I said, you realize that this is a natural product coming from the gut to begin with. So that parallel really excites people in knowing that I'm giving you something to treat your gut and treat your skin that came from your own gut, essentially. So combining that with TB4 and explaining the other effects of that and how something as simple as a peptide can influence your skin disease is very important. And look at even today with lorazepam, the importance of lorazepam and zonulin and its effects in COVID.
One of the other, I think, fascinating pieces, specifically with Thymosin Beta-4, is the impact that it has on angiogenesis or improving blood flow. So talk to us a little bit about why is improving angiogenesis when it comes to dermatology, aesthetics, recovery? Why is there a connection there?
Well, there's so much to deal with blood vessels and angiogenesis. It's so important in so many facets of skincare and improving skin. It's all based on blood and getting greater blood into the area you're improving the skin's. The one thing that I get caution people with in terms of things of angiogenesis, you have to be cautious in people with rosacea because rosacea is a disease of blood vessels. So very often, for example, people that take tretinoin or retinol or retinaldehyde, the one thing I tell people when they're doing it, particularly if they have what's called telangiectatic rosacea, is that retin-A has an angiogenic effect.
Yeah.
So it may increase your erythema.
Yeah.
But then we can deal with that aspect of it using IPL, which is intense pulse light therapy, to improve their blood vessels.
Yes. The other, I think, interesting, piece of the regenerative aesthetics is talk to us about what your typical protocol looks like. Because we have one leading up to, a regenerative procedure, whether it be microneedling, whether it be a vampire facial, whether it be a hair restoration, and then we have something that we do post. So I'd be curious for you to share kind of what does that look like for you?
Well, for us, it's importantly getting a physical and understanding what's going on with the person. And so before we see anybody in any cosmetic procedure, we have a whole questionnaire. We want to find out more about them and not just say, oh, you need this, or you need that, because we start to, as I stated in my talk, it's internal optimization first, and through that, we will achieve greater cosmetic results.
Yes.
So people find that curious at first because in most places they just go to the doctor and they go, I want Botox, or I want this, or I want that, or I want an IPL, I want this type of facial and what have you. But I created this company, it's called Beauty Within, and Beauty Within is really, I designed an iris of an eye so that when people walk in, they look at themselves and they see what they want to accomplish.
Yes.
And it's not just about aesthetics. Aesthetics is a minor part of what we're trying to accomplish. We want people to look into themselves and feel better about themselves because, the eye is the window into the soul.
Right, absolutely.
And the same thing with the skin. The skin is a systemic organ. It's not an external organ. And so people need to understand the importance of the skin as well as the other aspects of dealing with beauty from within and coming to our place, Beauty Within.
I don't know if you saw the paper, and I think it was the American Journal of Dermatology maybe a month or two ago, the impact that GLP-1s have on
tremendous.
Is that hydrogenitis suppurative?
Hidradenitis suppurativa, which is a very debilitating disease.
Yes.
It was so disheartening that we had nothing to offer. And as a matter of fact, the author of that paper is at the University of Miami where I trained. So I was down for our 70th anniversary of our department, and we were discussing that paper in particular because in the past we had very little. And when they get that fibrosarm scarring and it's happening in these young people, and
it's their mental health,
everything,
it's how they feel. So when I saw that paper, I was like, well, this is fascinating. I've seen actually some success doing a gut test, taking them through like a 5-hour protocol, utilizing low-dose naltrexone, as well as some thymosin alpha-1 and ozone therapy for that. But it's so exciting to see. It's like, just another use for GLP-1s because we see benefits in our osteoarthritis. We see benefits with gut health. I have a lot of patients that they say that their bloating gets better. Now, just as I said in my lecture, one of the side effects we see for a lot of different things is hair loss. And just as I said yesterday, it's so multifaceted. So can you talk through a little bit about what does your hair loss workup look like in your practice?
The most important thing is the patient information and the physical. Because we have, being a pharmacist, I'm always looking at people's medications, learning of certain medications that may cause hair loss and what have you. And then, unfortunately, we have so many people, and in particular women, that have Hashimoto's thyroiditis that don't even recognize it. Or when they're even going to an endocrinologist, quite often, they check the TSH, T4, or maybe T3 uptake, and they're missing the boat. I try to explain to people, we have T4, we have T3. T4 is our crude oil. T3 is our fuel. So unless you can convert that crude oil into gasoline, your car's not going to work.
I love that analogy. We say T4 is money in the bank, T3 is cash in your hand. You're not making bank transfers.
Exactly. And so, even as a dermatologist, I unfortunately, I see these situations. So half the time, we can correct things by just telling them this needs to be done. I need you to. I give
Right.
a listing of what they should be going for.
Yes.
The T3 resin uptake, as well as T3, T4, checking thyroid globulins and everything else, the TPO.
Yeah.
And then we can make a decision.
Sure.
If at that point we can't find the cause, I mean, then we start looking at other avenues. And
Sure.
again, I use a lot of spermidine in my practice. I mean, I see tremendous results with spermidine
For hair
loss.
restoration?
Yes.
Oh, so talk us through a little bit about, so you've done the workup, we've deemed them a candidate for some sort of hair protocol. Can you talk a little bit about where spermidine would come in versus maybe like Regenetides?
So I would put people on spermidine first because we know that it has an effect on the hair. It converts it back into the anagen phase. And so that alone is something. It affects hair shedding as well. And then I have them on, and I tell people, you're not going to see changes for several months.
Right.
But the one thing I will tell you that it also does is increases nail growth tremendously.
Okay.
And that's one thing that excites people. Like, oh my God, I'm having to cut my nails every 5 days,
Yeah.
every 7 days. It used to,
Yeah.
I'd cut my nails every 10 days
Yeah.
and what have you. So they start to see those changes immediately. And then they recognize that maybe something's working.
Right.
And even for brittle nails, it works extremely well for brittle nails. Onychoschizia.
Did not know that. So you talked about how spermidine can help put the follicle in the anagen phase. Another one of our favorite peptides that also does that is GHK-Copper.
I know.
So talk to us a little bit about what impact would GHK-Cu not only have on the hair but the skin as well.
Well, GHK is so important. You know, I remember, because as I was discussing, we do a lot of laser surgery, and in particular, with InMode, we were using the Morpheus device, and so I always test myself first.
Yes.
So I was injecting myself with BPC 157, TB4, giving myself GHK. I never told anyone. So I do my Morpheus, and everybody else do theirs, and they go, why do you heal so quickly?
Yeah.
I go, I don't know. I think I'm just a quick
Yeah,
healer.
just lucky.
So then I spill the beans and say, well, I've been doing this, I've been doing that, I've been adding this to
Yeah.
it and stuff. So
Yeah.
it's a very important armamentarium to
Yeah.
add. You know, the biggest problem is when you talk to people for the first time, if they've never injected anything,
Right.
they have so much fear as
Needle
associated-
phobia.
Oh,
Yeah.
total. Or they want us to inject it in them.
Right.
You know, every day and what have you,
Yeah.
which gets logistically
Yes.
a little bit more difficult.
Yes.
We're there to help them in the beginning, but then we want to teach them how to do it themselves.
Right, absolutely. So tell us, if someone is a little bit needle shy, do you find that the topicals, like a GHK or a zinc thymolin combination, do you find that those are effective?
You know, it's very interesting. There's a friend of mine out of the West Coast with Oro,
Oh, yeah.
Dr.
Nice.
Patel.
Yeah.
He's a good friend of mine,
Yes,
and
yes.
I'm always trying some of his products.
Yes.
And I will tell you, some of his products are pretty amazing. He has an intranasal form of NAD.
Yes.
His glutathione is
Yeah,
amazing.
I have some upstairs. Yes, I use it. in
You
our
were talking
practice.
about it.
Yes.
Is that the title?
Yes, yes.
I
it's
love
Nian's
that product.
Yeah.
And so he also just really came out with a copper peptide.
He told me that.
In a topical
yes,
form. He sent me
yes,
some to try, and I'm
yes.
telling you, I think it really works.
Okay. Well,
So he's a really smart guy. He's come up with some great products.
Yeah.
And then I also work a lot with Young Goose and their products. Which I told you about the LADR.
Yes. Yeah.
And he has a lot of spermidine-based products in his combined with NAD. So he uses a lot of spermidine in a lot of different products as well.
So I think you mentioned in your lecture about using a topical methylene blue.
Yeah, this is amazing.
Yeah. Talk to us a little bit about that.
So, and you know, people love it as well. So after somebody goes for a diamond glow facial and what have you, or a traditional facial, we go, oh, after this, we're going to have you go in the room, quiet room, lights down, and then we spray the methylene blue all over their face. We pat it on their face, wait a couple of minutes, and then we add the other product, the LADR by Young Goose, which has spirulina, NAD extracts, and what have you. And then we put them under the blue light for 15, 20 minutes. And I'm telling you, you walk out, your face looks amazing.
Really?
Yeah.
So Young Goose was the product for the...
So Young Goose actually made the product for MitoPure.
Yes.
Right.
Yes.
But it was their formula, and then when they
Right.
came out with their new mask, they combined that together.
Okay.
So the mask that I was talking about, it's only been out about 2 weeks
Okay.
time.
Okay.
And
Yeah.
so, but they were both designed by, his name is Amitai Ishar.
Okay.
And
So if an aesthetics maybe focus practice is like, I want to do this, I want to serve kind of from within, what would you say would be like the first steps to maybe getting a better understanding of how to approach it, how we do, more from a cellular level instead of just what's happening on the outside?
Well, I think going to conferences like this, and as I said initially when I discussed my talk today, I mean, we really have to be grateful for people like Leonard and Frank.
Absolutely.
And again, from being a pharmacist perspective and seeing how these guys went to the next level, and have people like you and the entire people in the Nucleus Pro and teaching people. And that's the basis. And one of the other things, because our talk was short, and is I really wanted to mention the fact that there are so many influencers and biohackers out there using products, you know, and then when you buy them, it says for animal use only. You don't know what you're getting. They are expecting a person to add the diluent, and there was a case just recently, I don't know, you heard, where the woman injected tap water, and the results were horrendous. So it's great to also have a company that does things properly, following the compounding rules, 729, and all these other aspects of it. So when you have a group of individuals like that you're teaching people the right way, and that's the most important thing, because this is a science, and it needs to be learned, and we all started out in the beginning, and we've all progressed and learned more because we go to conferences and listen to other people and list not only our successes, but more importantly, our failures. I think I learned more about things that didn't work well for me than things that did work well. And I'm sure we've all experienced that in every facet of medicine.
Well, your lecture was amazing.
Oh, thank you.
I thoroughly enjoyed hearing you speak, and I hope to hear you again at future conferences. And thank you for joining, the conference, and hopefully, we continue to work on projects together
That sounds
and
great.
sharing clinical data.
Great. Thank you so much. Appreciate you. Bye-bye.